Welcome back to the Acupuncture and Herbs podcast. Today, acupuncture beats drug for post-stroke constipation relief. This was published at healthcmi.com on May 24, 2019. Let's take a look. Chujing First People's Hospital researchers investigated the benefits of the Shugan Tiao Qi, that is the liver soothing and qi regulating acupuncture protocol, and the drug treatment for the treatment of post-stroke constipation. So peristaltic movement, basically elimination and bowel movements, can be severely restricted after a stroke. This is very serious. There are a host of other things that have been researched regarding acupuncture and herbal medicine for relieving post-stroke syndrome, including dysphagia, trouble with swallowing, things like this. But let's take a look at this. Now, this research is very interesting because not only did acupuncture outperform the drug lactulose, which is a synthetic sweetener with laxative properties, but it also was more effective in regulating different hormonal substances in the body, like substance P, for example, motilin, other substances. So acupuncture was able to regulate these internal hormones to the benefit of the patient, including vasoactive intestinal peptide. So what we see here is that the blood chemistry is also improved with acupuncture. That's very important. And the constipation itself is relieved. So this is kind of a two-part study where, one, they're seeing if the constipation is relieved. Two, what are the effects of acupuncture on blood chemistry? So it had a normalizing and regulatory effect. Acupuncture outperformed the drug, which is also interesting. So better results. This is not unusual. Keep in mind that acupuncture for the treatment of post-stroke syndrome has a long history, particularly with scalp acupuncture, but also with local points. And here, if someone is a licensed acupuncturist, they'll love to see this because it outlines the entire treatment procedure from what type of needles used to where they were put. The whole 9 yards is laid out. And for the layperson to really, what is they going to expect in terms of results? This is a great article also. Most of the articles we push out into the news department at HealthCMI are designed for everybody, whether they're doctors, licensed acupuncturist, or the layperson looking to learn more about their health and what options they have. I would go so far to say, from my own personal experience in the treatment of post-stroke syndrome, that acupuncture is essential because it does improve patient outcomes, and it does improve them dramatically in terms of memory, in terms of restoration of movement of the limbs, in terms of strength, in terms of relief of constipation and swallowing disorders, and many other things. So there's a track record here. Traditionally, this treatment formula, the acupuncture points here, have been used for over a millennia. But now they're tested with the scientific method. Lo and behold, they outperform the drug. It doesn't mean that we shouldn't use the drugs, but we know that acupuncture is effective. So it either can be used in place of it or in addition to it. So go to healthcmi.com, take a look at this study. There's a great selection of points. We do make some comments on that because, one, they chose experienced licensed acupuncturists to implement the acupuncture therapy, and two, they chose traditional points that are used for the treatment of constipation and then tested it with a modern scientific method. Some standouts from the point selection were some 8 extra channel usage. So that would be Neiguan and Gongsung, PC6 and spleen 4, which are paired together traditionally for heart, chest, and stomach disorders. Another standout was the use of CV6, for example, Qi Hai, and Tianshu, stomach 25, which are classic local points used to restore peristalsis in people with just generalized constipation as well as post-stroke constipation. Also helps to revitalize digestion. So there's a lot here. Interesting stuff because it got results. And that's what we're looking for with medicine. When someone is ill, there is no east, west, left, right, up, or down. There is just getting better. Here, the scientific data shows that acupuncture is effective for the treatment of this condition. So take a look. Thank you for listening. I'm Adam White, licensed acupuncturist. Visit us at www.healthcmi.com, click on news, and take a look at the article. Thank you.